The number of overdoses and overdose deaths due to heroin and other opioids is down in Greater Cincinnati in 2019. But as David Winter reports, some other interesting trends are coming to light this year regarding drug abuse.
Since its peak in 2017, heroin and other opioids have been the main focus in the fight against drug abuse and decreasing the number of overdoses and overdose deaths. And while the total number of overdose deaths in the area have decreased 14% since last year, an unexpected trend seems to have emerged.
My drugs of choice was heroin and crystal meth. I used both those on a daily basis for a very long time.
Derek is an addict. Half of his life, 18 years, spent trying to score, living under bridges, and alienating friends and family. And he's not alone. The drugs abused by those admitted in the last 3 years at the Center for Addiction Treatment, or CAT, in Cincinnati have changed. In 2017, more than 3/4 were heroin and other opioids. Amphetamines, mostly meth, did not even register. That is, until this year, when 4% who entered the program entered because of meth.
That kind of word on the street is, this is a safer alternative.
Other than the misconception that it's safer than opioids, this nurse at CAT says it's reemerging because it's more available than opioids and it's cheaper. While those things are true, it's definitely not safer.
The theory is it's coming up from South America. That's a theory, and it's a much higher grade. So that takes it to a different level than of what we used to see. And
the trend line is that we're losing less people year over year right now, but we are one bad batch away from having that spike back up.
Hamilton County Commissioner Denise Driehaus is cautiously optimistic. Opioid abuse is declining, but she says much of the decline in opioid deaths are due to a huge increase in the use of the counter-effect drug Narcan. But she's also concerned about two other trends in overdosing deaths. The number of people over 50 who are dying due to ODing, it's on the rise, and so are the number of African Americans. So for now, it's just cautious optimism.
Are we having an impact? Yes. Is it a positive impact? Yes. Is there more work to be done? Yes. So we'll just keep doing the work.
And hopefully keep impacting people like Derek Wyatt.
I'm able to, hold a job. I'm able to be a brother. I'm able to be a good son today, all because, I wanted something different.
Well, the nurse at the Center for Addiction Treatment says meth is much more dangerous now than it was in the 1980s and 90s because the dealers are lacing it with the same thing that kills so many opioid users, fentanyl. It provides a much more intense high that's also more addictive and more likely to kill. Paula.
Thank you, David. The Center for Addiction Treatment says meth is one reason why the percentage of admissions for white people has dropped 8% since 2017, replaced by an increase of 8% in African and Hispanic American admissions.